My name's Tyler Welch. I'm a partner and orthopedic surgeon here at Atlantic Orthopaedics and Sports Medicine. So here today to talk about the ACL, which is a ligament in the knee, and go into ACL tears and treatment options for ACL tears, including surgery, which is a very common procedure that is done. The ACL stands for the Anterior Cruciate ligament. It's a ligament that makes up one of the four major ligaments of the knee. It sits really right in the middle of the knee. And so this is a knee model. The ACL sits right in the middle. It's this white one right in the middle. The ACL has two bundles, essentially two parts to it that help provide stability to the knee. One bundle provides what we call front to back stability in this direction. And then the other part of the ACL provides rotational stability. And so when the ACL is torn, you lose both front to back stability. You also lose rotational stability. So the most common individuals who come in had an injury, on the field or in practice, or they were just playing with their friends, and they noticed something felt wrong. Sometimes they'll even describe like a pop or an abnormal feeling in the knee, and they usually get swelling the next day. So anytime the knee is swollen after an injury like that, that's concerning because it suggests that something did tear. When we suspect that there's an ACL tear based on our exam and again, what the patient's symptoms are and how it happened, the first thing we want to do is confirm the diagnosis. So we often have to do an MRI of the knee, which shows us the soft tissues of the knee and will give us a really good idea if in fact there is an ACL tear. The other advantage of the MRI is being able to see the meniscus pads, which are these pads that sit in the knee. There's one on the outside and one on the inside. And those structures can also tear when you tear your ACL. When we do the surgery, we actually put tunnels in the tibia bone, one in the tibia bone, one in the femur bone. And that's how we attach the new tissue to the knee. The way we drill those tunnels now is much different than the old way. And so now we call it an independent tunnel technique, where we actually drill the femur tunnel in a different trajectory than the tibia tunnel. The old technique, we would just use one trajectory and drill both tunnels. The problem with that technique, for most people, for most surgeons, it helps restore the translational stability, but it's not good at restoring rotational stability. Because again, you want to get both of those back when you do ACL surgery. But when you use the independent tunnel technique, you can get the ACL back in its perfect position, and that helps restore both the translational and rotational stability. So it's a really important technique now that we use when we do up-to-date ACL surgery. ACL surgery recovery process is pretty straightforward. We allow patients to put weight on it right away. They're typically in a brace for about 2 weeks until they have appropriate control of their leg and they're strong enough to walk on it. We have patients work with physical therapists to work on their range of motion, strength, balance, something we call proprioception, all these things that help patients feel more confident on their feet and get their strength back. The good news about ACL surgery is that discomfort, the pain, the swelling, it goes away pretty quickly. It's just hard, especially for young patients, because you have to limit them playing sports. And the bare minimum for sports is 6 months. I used to remember admiring the trainers and then surgeons actually fixing the problem, actually going in there and fixing the problem and getting patients back on the field was even more appealing to me because I like that hands-on ability to literally go in and fix the problem. That's the main reason I went into sports, is because I like the patient population, but I also like actually going in and fixing the problem with my hands and using the techniques I've learned over years and years to get people back to doing what they love.